Molly Pan, Informative Speech. Many of you guys might have heard of Alzheimer's disease, Parkinson's disease, and Huntington's disease, but have you heard of ALS, the amyotrophic lateral sclerosis? ALS is more commonly known as the Lou Gehrig's disease. After the death of the Yankee player Lou Gehrig, died of ALS in 1941. Today I am going to talk about the symptoms, the diagnostic, the cause, and the treatment of ALS. So what is ALS? ALS is a disease that defined by the death of motor neurons in the patient's brain, brainstem, and spinal cord. And it will cause fatal muscle paralysis. According to an article from the ALS Association from 2014, about 20,000 to 30,000 Americans have ALS, and about 5,000 Americans get diagnosed every year. And it typically strikes people from age 40 to 70, but it also appears among younger generations as well. And it appears a little bit higher in male than female, about 20% higher. So the symptoms of ALS differs from person to person, but mostly starts with contractions in muscles, including but not limited to like your hands, your arms, your legs, your breathing muscles, and also like swallowing muscles. Other symptoms might include thick speech, like people might have difficulty in projecting sounds. In more advanced patients, they might have difficulties in breathing and swallowing, and eventually most of the patients will die from respiratory failure. The diagnosis of ALS is very difficult because the early symptoms of the early stages are very similar to a lot of other diseases and disorders that's similar, such as like Alzheimer's disease and Parkinson's disease. So the patient will have to go through a series of tests to eliminate all the other possibilities to be diagnosed with ALS. Despite years of research, relatively little is known about the cause of ALS. Now we know that ALS is caused by abnormal aggregation of proteins within the cell. According to an article from Shaw from 23andMe in 2009, there are two types of genes that's related to the cause of ALS. The first type is FALS, which is familial ALS. It runs in the family, so the patient might have a family member that also has the ALS. And the second one is the SALS, which is the sporadic ALS, which is not run in the family, and that might consist of a lot of different genes such as SOD1, CHGB. They're just random genes on the chromosome that cause variations and cause the symptoms of ALS. So although we know very little about the disease itself, but are there any treatments of ALS? The answer is yes and no. Now there is a medication called Riluzole that is approved by FDA in 1995, used in most of the ALS patients. According to an article by Walke from Lancet in 1996, Riluzole shows approximately about 2 months prolongation of the patient's lives. And more recent studies have shown from an article on National Institute of Neurological Disorder and Strokes in 2014 says Riluzole works better with early stage patients that are not that affected by their motor functions. In addition to medication, there are also physical therapies and speech therapies available. The physical therapies mostly include gentle aerobic exercises and stretching and range of motion type of exercise to prolong the muscle use for the patient. And according to another article by Pamela Mathey in 2014 from American Speech Language Hearing Association, the speech therapist will help the patient to speak louder and clearer. And for more advanced patients, it might help them to develop some method to help them communicate with others, such as blinking and wiggling fingers. Because most of the ALS patients die from respiratory failure, according to another article from ALS Therapy Development Institute from 2014, a breathing support is normally used for the final stage ALS patients to help them ventilate better, but still it does not prolong their life or stop the progressing of their disease. To conclude, ALS is a very rare fatal muscle paralysis disease that is treatable but not curable. There are a lot of researches going on finding out the mechanisms and the cure for this disease, but hopefully with all these research, ALS will be a curable disease in the near future.